Good morning, Hawaii. Welcome back for another Wellness Wednesday segment. We have Dr. Chen joining us today. Thank you so much, Doctor, for being here.
Thank you for having me.
Thank you. So you're here to talk about the link between high blood pressure and kidney issues, and you're going to be taking Mika's blood pressure right now. And while he's doing that, I just was so interested in him coming because Kaiser Permanente recently released a study that shows that Asian and Native Hawaiian and other Pacific Islanders have significantly a greater chance of developing hypertension, that Caucasians or Hispanics who are in the same weight category have similar levels of similar levels. So the ethnic makeup of our state means that our residents are much more likely to develop high blood pressure. So that was a big eye-opener for me. Also known as the silent killer, and those with high blood pressure might not feel alarming symptoms, but could quietly cause damage that threatens their health. So while doctor's taking that, and he's going to explain to us the link between high blood pressure and kidney issues, right, doctor?
Absolutely.
That's right. I'm bothering him. But I do know, so while you're taking that, I guess I'll share some facts that you shared with me. The normal range for pressure is less than 120, right?
Absolutely. So yeah, the completely normal range blood pressure is 120 over 80, and luckily, Mika, your blood pressure is just fine.
Ooh, okay, good.
Perfect.
So you've taken care of your annual screen.
So can you let us know, what does high blood pressure do to your body first off?
Absolutely. So high blood pressure, or the elevated blood pressure in that, puts stress on the walls of our arteries. Over time, this damages the arteries, interrupting blood flow to the organs and causes tissue death in the organs. If we think from head to toe what this causes, in the brain, the tissue death can cause stroke. In the heart, it can lead to heart attack or even heart failure as the heart kind of squeezes against that high blood pressure. In the kidneys, it can lead to chronic kidney disease and kidney failure. And in our large blood vessels, it can actually cause aneurysms, which is ballooning of the arteries, or dissections, which is a shredding of the arteries, both of which can be life-threatening and fatal.
Yeah, very scary there.
Yeah.
And so you just talked about the link between the high blood pressure and kidney disease, right? And then what can we do to treat high blood pressure, doctor?
Yeah, so as far as treatment, the first thing we want to really focus on is lifestyle modification. When we think of that, we think of exercise. You know, doing exercise most days of the week, at least 4 to 5 days, 20 to 30 minutes of a cardiovascular activity really can reduce blood pressure, as can weight loss. Next, we want to think about diet. Here in America, we eat probably tons of too much salt. A recommended salt intake is about 2,300 milligrams per day, and the average American diet is about 3,400. I think here in Hawaii, I venture to say it may be even more than that.
Yeah.
I think we really have to watch our Asian sauces, so shoyu, fish sauce, things like that.
And our sugars as well, right?
Exactly, yeah.
Mika and I did not just have a cookie for breakfast.
Nope, didn't happen.
Yeah, so diet can play a big part. There's specifically a DASH diet, which has been shown in studies to reduce blood pressure points by 11 points. And finally, we really want to focus on stop smoking. Smoking with the nicotine damages arteries, and also alcohol intake. Limiting our alcohol intake, or drinking in moderation. For a man less than 65, it's 2 drinks per day. For a female or a man over 65, it's about 1 drink per day.
Well, thank you for that, doctor. Very informative and very helpful. I'll have more information on our KITV website. And again, if you know somebody that you love or anyone that you know that has a high blood pressure, just to remind them to, monitor their levels and just live well. So thank you so much for joining us, doctor. And we'll be right back on Good Morning Hawaii.
Thank you.
So thank you.